In your health headlines, it's an issue men in their 30s start to experience, the gradual decline of testosterone. And the significance of this decline is controversial and not really well understood. To talk more about it all, I'm joined by Dr. Mitchell Goldman from UCSD. Good to see you, Dr. G.
Great to be here, Kathleen.
So if you're a young man, what are some of the telltale signs that your testosterone might be on the decline?
Well, there's a number of different ways to know that. One is you're getting a mood change and you're maybe getting a little bit less angry, you're getting a little bit more lazy, your fat is increasing, and you're just a little more tired. And so those are the things that mostly come out. Now, lack of libido is what most men actually think about. And so what we find is that this testosterone industry, the low T type of commercials, has increased the number of men getting testosterone supplementation tenfold in the last 10 years.
Because a lot of men, I can imagine, they just might think it's the natural part of aging. So what is really going on when there is a testosterone deficiency?
Well, Kathleen, you're absolutely right. The number one reason for testosterone starting to fall after age 30 is we're getting older. But there's a lot of other reasons. Reasons that really we can change are obesity, alcoholism, and then also types of genetic abnormalities and dysfunctions in your hormonal system. But really, number one is age, and then number two is probably alcoholism, chronic illness, and stress. And so those are the reasons testosterone levels fall.
And so what should you do about it? Like, how do you get diagnosed or really even just raise that red flag for your doctor?
The only way that you can test your testosterone level is actually through a blood test from your physician. And so you can see where your testosterone level is. But then once you know that if it's low, if it is low, there are a number of ways it can be supplemented, from getting a shot of testosterone to actually rubbing a gel on. But the problem is we don't know what else happens. You know, a recent study just last week in the Journal of the American Medical Association demonstrated that most men that are getting testosterone supplementation probably don't need it, and they have an increased level of plaque in their arteries. And so one of the things we worry about is that if men are getting testosterone supplementation and they don't really need it, are they going to get an increased risk of heart disease?
So are there any natural methods or things that you can do just to try and either stave it off or improve your testosterone levels?
Yeah, the most natural way to do it is exercise and exercise and exercise. But you know, you have to exercise.
So what you're saying is exercise.
Yeah, I think so. But it's working out. It's increasing your muscle strength and then decreasing your alcohol intake and decreasing your fat content. Because the problem is, if you start doing testosterone supplementation, some men will actually see an increase in their libido, but that doesn't last for long. And all the studies show that the testosterone supplementation really doesn't increase your memory, doesn't increase your libido that much, and after a few months it actually goes away. And if you do testosterone supplementation, sometimes you can actually start growing breasts because the testosterone that gets in your system that isn't supposed to be there gets converted to estrogens. And so there's a number of different interactions that occur.
Yeah, so it sounds like that's the challenge with testosterone, the same way women who are trying to do estrogen replacement, there are side effects to consider.
So it really needs to be done under a doctor's care.
All right, Dr. G, very interesting topic, things that we may not think about. Thank you for bringing it to our attention.
Great to be here, Kathleen.
Good to see you.